The challenges are numerous, as you will be very well aware. If we have to pick on one aspect, I suppose the uncertainty. We have a vision, and the vision has been defined about the patient engagement, the quality, the outcomes, putting clinical decision-making really back into the heart of clinicians. Of course, how the accountability for the use of resources will also sit there has been identified. But if we have uncertainty as to how this is to be achieved through process, then that makes the whole situation more difficult to progress through in terms of how we actually build our organisation. The HR framework has been deferred now till March. If we're in a position of moving forward with hard commissioning budgets from April, with a view then to having organisations as statutory bodies even sooner than anticipated in 2013, then we do need this sort of information. How we actually build our organisations with the whole multi-skilled team, because of course it's not about just GPs, it's not about just clinicians, it is about the whole structure that sits beneath that, and those people primarily sit within the existing NHS organisations. Without that guidance, then we're at risk of moving in an inappropriate and a way that would have to be altered perhaps avoidably.
How concerned are you about this, given that we're only a few months away from this time?
Well, we're extremely concerned. What we need to do is be able to take a view as to how we can actually progress this forward. It's not going to be acceptable to start trying to build these teams of people with 2 weeks headroom on hard budgets coming down to us. We need to be doing this now. We would hope to get some clarification as best we could from the Secretary of State. Realistically, I'm not sure what he will be able to tell us, but I would like to think we would at least have some view on a way forward.
Presumably you're anticipating that a lot of these staff that you're talking about are going to come from the Department of Health, Strategic Health Authorities and PCTs.
Undoubtedly. That is where the skill mix in the health economy lies. The people who have the ability and who have the history of doing this, that is where they currently reside. But what we have to do is take those people who have those skills, and we have to build a new organisation that is different to what currently exists. This is not about just moving from a PCT to a consortium with no change. We can't do things the way we currently do. The resource will not support that. And to achieve the visions that we've already outlined will require a different way of working.
And what happens if this is not in place by April?
Well, if it's not in place by April, you can't take on hard commissioning budgets. If you don't have an appropriately constructed organisation, you're putting yourself up to fail. You cannot take on those budgets at that point in time.
But you still only have 2 months in which to do it?
Absolutely. And if we can't do it, if we can't actually build that team, build that organisation appropriately, because we're constrained by the deferment of the guidance that we expect, then we have to defer taking on those hard budgets. This cannot be put up to fail. It has to be done in the appropriate way to ensure the safe transition through.
That, as you see it, is the key challenge.
Well, it's the key challenge we're facing today amongst all of the other challenges, but that at the moment is what we really do need to drive forward.
And how worried are you at this stage that we are only weeks away from that time? There are a lot of staff to put in place and that it simply won't happen.
I think it's about managing the process rather than worrying about it. You deal with it in the most effective way that you can. We will have contingencies in place so that we just defer moving forward with hard budgets if it's not doable.
And what would the effect of that be?
Well, it delays the whole process further. If we're looking at the rapidity that is needed, and this has been clearly outlined by the Secretary of State and by the Prime Minister, then we do need to have the processes flowing through with the rapidity to match that.